You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Drew Ordon, MD. Dr. Ordon is a board-certified plastic surgeon that is here today to talk about the keys to a natural-looking facelift. Dr. Ordon, welcome to the show.
How are you, Randy?
Now, we've had you on the show before, and for those that don't know you, you have your Beverly Hills office and here at the Plastic Surgery Institute. Tell us about your practice.
Right. It's been some time now that I've been splitting my time between the Desert office, the Plastic Surgery Institute, which we started in 2000, and my Beverly Hills office, which was completed several years ago, and I still manage to juggle my time between the two offices.
Now, according to my notes, you have 3 board certifications. Tell me about those.
I do, Randy. I first did general surgery, then I did a residency in otolaryngology or head and neck surgery. I'm board certified in that. Then I did a residency in plastic and reconstructive surgery. I'm board certified in that. And I also sat for the boards in cosmetic surgery.
Okay, now today's topic, a natural looking facelift. Still a lot, and we've talked a lot off camera about this, you still see that pulled, stretched look. So we want to talk about the keys to a natural looking facelift and what you can do as a surgeon to make it look natural.
Randy, I would say with every facelift consultation that I see, inevitably it comes up talking about that overly pulled, unnatural look. That's something that the people want to hear going into the surgery that they're not going to have. And the key thing to remember, Randy, is if somebody has a facelift done well and naturally, when you see them walk down the street, you're not going to know that they had the facelift. It's only the facelifts that have those giveaway telltale signs of
a tight look.
Well, there are a number of things. Losing your hair in the hairline, the overly tight look based on pulling too much, too often, or on somebody who really didn't need it. The direction of pull is probably the single biggest thing, that if you pull back, you're going to get that wind-blown or pulled look at the corner of the mouth. Face neck lift should be more of a vertical lift where it's up and back, putting tissue back where it was before it slipped due to gravity.
Now, I interview, and the Wellness Hour now airs in over 8 states. It seems that every plastic surgeon has a different approach. And why is that?
Well, Randy, there's a big range amongst surgeons who do facelifting, and it involves a lot of things: age, experience, the type of training. Even amongst board-certified plastic surgeons, they may have trained more in a program that was leaning towards reconstructive surgery and less elective cosmetic. They may not have done many facelifts. They may not have done many facelifts early on in their private practice, to be compared with somebody who has been doing facelifts from the get-go. So just based on that, there's a big variation.
So art or science? I mean, well, artistic talent, is that
Randy,
the key?
It's both. And that's the key. It's combining the two. Because this really is tailoring an art to the max. As you know, as a board-certified plastic surgeon, I do everything in plastic surgery. But at this point in my career, I am really focusing on facelifting. I mean,
in Beverly Hills, you're known as the guy for the facelift.
Well, there's some great facelifters in town, but as you know, I practice in Beverly Hills. I was trained and practiced on Park Avenue in New York, where I learned a lot of my facelifting techniques with some of the biggest names.
I've also been told, and we talked off camera, that you attract a certain type of patient, the natural-looking patient, the one that doesn't want that tight look. But I have to ask you, do people want that tight look, that pulled look? Do they come to you and say it?
Well, sure. As a plastic surgeon, it's all about patient selection, and sure, we're always confronted with patients that have unrealistic requests, that want something that's unnatural that we can't achieve.
So they say, I want to be pulled tight.
Well, for example, a younger patient that comes in that, I don't care who you are, you can pull a baby's face and get them a little bit tighter. You have to have X amount going on before it's worth doing the surgical intervention and doing the facelift. So some people just aren't a candidate. But to answer your question, absolutely. We have people that really don't need it, and they come in and go, I want to look like this, and just go, well, that's not what we do. That's not a natural look, and I would discourage you doing that.
Now, I've seen your before and afters.
Okay.
And So what is your
you
goal?
know, some of my patients too.
That's right.
I've seen them out socially. And
they look good. They look good. In fact, some people look like a younger version of themselves. So what is your goal? You want to make them look younger? You want to make them look different? What is it?
Well, depends what their ultimate goals are. I mean, we're a little concerned about, you know, wanting to change somebody completely. I had a couple of requests like that when I practiced back east. Somebody that was in the wrong place at the wrong time and wanted a complete change of their face, so
right.
Sort of like the Humphrey Bogart movie. But people have asked me for that type of thing, but that's pretty unusual. Most people say, I still want to look like myself. I just want to look more rested. I want to look how I did 10 years ago, 20 years ago. And in most cases, we can deliver that. Now, the modern day facial rejuvenation, it's come such a long way from when I started doing facelifting in 1980. The lift itself nowadays is totally different than when we started doing it in the early 80s. First of all, it's not just pulling the skin, but it's pulling the underlying layer of tissue which is connected to the muscles of the face.
Well, help me understand exactly what's going on to the aging face. As simple, I guess, as that seems. What's going on?
We have skin, and we have the underlying structures of muscle and connective tissue sitting on the facial skeleton. There are structures which hold it in place, sort of suspensory ligaments, if you want to call them that, but in time they start to fall. So as things give, things fall on the facial skeleton, and you see the typical signs of the aging face, specifically nasolabial line, jowls, and banding in the neck.
Okay, what are the different categories then of facelifts, facial rejuvenation? I mean, what are the different areas?
Well, you can break up the facelift. The facelift is not a facelift. It depends where the patient needs improvement. There's the so-called just cheek temple lift, where somebody just wants lifting of the mid-face.
Is that a mid-face lift?
Well, it is. It's a variance of the mid-face lift. For the younger patient, you may be doing more on the deeper tissues. There may be less skin excision. You can call it a cheek temple lift or a mid-facial lift.
When you say younger patient, how young? Are the patients younger and younger now?
Absolutely. That it's younger and younger for elective facial rejuvenation.
What are the ages?
Well, we start seeing patients in their 40s that want to do the mid-face lift, that want a cheek temple lift to just give them a little better look.
It's subtle.
It's quite subtle,
And what does that do, the mid-face lift?
Well,
bags under the eyes? What is it?
It's not really going to help the bags under the eyes per se. It's more going to help the mid-face, where helping the malar fat pad, which has fallen and given sort of a drawn look. It helps the nasolabial line, and it helps the jowls.
So the jowls are eliminated?
Yes.
Okay, what else are you doing for the face?
Okay, so then if the classical facelift would entail lifting the cheek, the jowl, and adding the neck. Now you can do a isolated neck lift where you're just lifting the neck, but that's pretty rare, because for most people that need a neck lift, they also need some lifting and tightening in the mid-face as well.
Is it men and women?
Absolutely.
I mean, more men
10 years ago
forward?
it was about 5% men. I'd say nowadays it's 25% men.
Now, men, of course, I've seen some men, it makes them look very feminine.
Well, you have to be very careful there. And again, it's preserving the hairline and the sideburn. It's all about the direction of pull, not pulling too tight. I know what you're saying, and I think the single biggest thing that can feminize a man when you're doing facial surgery is the eyelids, where they lose their expression, they get sort of a glassy look, that the eyes look too good.
Okay.
When that happens on an older man, I think that
skeletal hollow look.
Right.
I see that.
Right. So if we do the eyelids on a man, we definitely want to be conservative, if anything slightly underdo, and in some cases avoid an invasive procedure and just do laser resurfacing to make the eyes better, give it a little more tightening, but without changing that the expression that's generated by the eyes.
What frustrates you in the world of plastic surgery that you see going on? Anything?
Well, what frustrates me is a lot of what frustrates the public, that I see something, and obviously I pick up more than the average person, but it's picking up on something that was obviously done.
A mistake. Would you say it's a mistake?
I don't want to use mistake.
Okay.
That I want to say that I would have done it differently. That there's always different opinions, theories, different way to approach something. But I see things that saying, that's overdone. And an excellent example is seeing certain celebrities with the eyes, older celebrities, actors, that I think have lost some of their...
Too much.
Well, yeah.
You told me less is more sometimes.
Hesitant.
What does that mean?
I don't want to mention any names because I think the celebrities, this whole thing about talking about what people have had,
sure.
I think it's gone overboard.
So you think they're going too heavy on the eyes?
Yes.
As far as the skin over the eyes?
The skin.
Too hollow.
And, removing too much skin and removing too much fat, too.